concerned because they missed part of it, everything is going to be uploaded to the website that went out. So let's go ahead and get going. Unless anybody has any other thoughts or wants to wait. And I don't know why I'm not seeing this. There's the chat. Okay. All righty, here we go. So this virtual webinar is really about us trying to help anybody who is being seen at a different CF center outside of the University of Minnesota, the adult CF center, and especially for anybody in pediatrics who might be segueing up or looking at transitioning up to an adult center, it can be a really overwhelming and kind of daunting task. And so we want to try and make this more approachable and easier for people. And this is our first time doing this, so we're hoping to hear some feedback from everyone and hear what you'd like to see next year, hopefully. All right, so our agenda, 6 o'clock to 6:15, we're going to do a quick overview of our first center visit, because I think that's what a lot of people suggested that they'd like to hear more about. And then we're going to introduce our entire adult center team and our roles. And then we're going to have a little bit of time in the middle for a brief survey so that people can take a look and kind of, while things are fresh, or if they have to run to do something, they can go ahead and do the survey. You'll also get a link as well after the seminar is over for the survey. But if you've done it once during the meeting, then you don't have to do it again, but it is there in case you think of something afterward. For the majority of the last half, we're going to really try and focus it on doing a Q&A with all of our adult center teams, so that if there are other questions that come up, we would really like to help and try to make sure that we answer your questions. If we don't have time towards the end and there are still a lot more questions, then we will do our best to provide email responses, as long as they're not like too individualized. All right. And again, everything's going to be recorded for the meeting, and at the end of it, a bunch of PDFs, this particular PowerPoint, and this session is going to be uploaded to the main page for the event, so that you can access these things at a later time. And we're going to leave you with some phone numbers and contact information as well. All right, some quick welcomes and introductions. Tammy, do you want to introduce yourself?
I can. Can you hear me?
We can.
Hello, everyone. So I'm Tammy Vance. I'm the social worker at the CF Center at Children's Minnesota.
Thanks, Tammy. I'm Sarah Keel. I'm one of the adult center providers at the University of Minnesota, the Cystic Fibrosis Center. I'm also one of the co-associate directors, along with Kathy Mahan, who will introduce herself shortly. And then Martha.
Hi, my name is Martha Garvey. I am the event support specialist for the Cystic Fibrosis Foundation.
And we are eternally grateful for all of your help in helping us get this set up and all the links sent out and coordinated. All right. So welcome to the first visit to the CFC. This is our clinics and surgery center. This is a really nice new building that was built like within the last 5 to 8 years. It keeps getting more and more farther out, but it's a really nice building. It can be a little daunting. It's definitely different than what you're expecting from the West Bank. So we're actually located on the U of M campus on the East Bank. We are off the green line for the light rail, if that's the way you choose to take. Otherwise, there's metered street parking and there's paid surface lot across the street. But we also encourage people to use the paid valet parking, just because it's a lot easier to do and less likely to be super late for appointments. Here's our address here. Again, a lot of this information you guys are going to get in a folder from your transitioning team, the pediatrics division, but it'll also be uploaded to the website afterward for reference. So your first clinic visit to the CSC, everything happens here. So you're going to check in for your doctor's appointment on the 3rd floor, but your pulmonary function testing, which will be done for basically every visit, is also located on the 3rd floor. Lab draws, x-ray, and most importantly, the cafe is located on the 1st floor when you come in. And if there's ever any questions, when you first walk in, there are multiple people at like desks in little areas. So if you need help and you're not sure where to go, you can always ask them, they'll direct you where to go. The pharmacy, the outpatient pharmacy, is also located on the 1st floor. So there were some questions about how we would be able to see your electronic medical record if you were coming from a different center. And so from our pediatric center, from the Minnesota Children's, we can see Epic electronic medical records. So we will have access to all that data. The children's teams also sends copies of your records with permission once you've given it. So we get a paper copy that gets uploaded, and we all do try very hard to review all those things before we actually meet you for the first time. On top of that, and if you're coming from a different center outside of the state, which we definitely have seen before, then we oftentimes try and get all those records sent ahead of time as well. So a clinic visit and what it kind of looks like. So a clinic visit is currently located on the 3rd floor in an area called 3K. all team members will follow the CF Foundation infection control guidelines. And so we all wear gowns, gloves, and a surgical mask now post-COVID. I do want to let people know that in the waiting room areas, there is a new change that's coming about for the University of Minnesota, and it's possible that not everybody in the waiting room will be masked. And so we do encourage you to continue wearing a mask before you're seen. We do try to get you roomed as early as we can so that you don't have to sit in the waiting room or be exposed to other sick potential patients in those rooms. You'll be roomed by one of our 3 very excellent pulmonary certified medical assistants. So that includes Lakeisha, Latoya, and Mackenzie. They're all 3 very, very experienced with our CF team. And rooming includes vitals, a medication review, and a throat culture if you can't provide a sputum for culture. But if you can provide a sputum, you'll get a sputum cup to go ahead and expectorate into. Providers and the team members will see you in the same clinic room, so you don't have to move rooms. You just sit there and wait for us to come in, and we kind of just do a kind of a roundabout merry-go-round of people. It's kind of a revolving door. We do follow the CF Foundation guidelines of care and see our patients every 3 months. That can be adjusted, so we can see people more frequently than that if we think that we need to, or there's more things to follow up on. I know with that first transition visit, sometimes there's a lot of things to cover. And if that's the case, some of us might choose, or we might have a discussion with your provider about seeing people more frequently or making a faster appointment if needed. And then the other team members, which we'll get to in a minute, will see you yearly or as needed. And they're usually almost always somebody's available in clinic at the time of your visit. So even if you weren't necessarily planning on seeing the dietitian, or you weren't planning on seeing the PharmD or the social worker, if you have needs or issues, then we're happy to try and get you connected right then and there if you have time. All this being said, because we do have a lot of team members who are really anxious and interested in meeting you and getting to know you for that first visit, your first visit and subsequent visits, especially that annual visit or the one where we're going to see everyone throughout, might be quite a bit longer than you expect. So even though it might only say 40 minutes, you have to book in time for your pulmonary function testing and then any potential lab testing as well that might be ordered, and time to see all the different providers. So I would plan on a couple of hours at least for time spent at the CSC. One thing we have talked about is that I know that that first visit for some people can be pretty overwhelming to meet a lot of new faces. And so one thing that we talk about doing is sometimes staggering the visits. And so maybe you don't meet the whole team for that first visit. Maybe you meet a couple key players, and then we make sure that you meet the rest of the team as time goes on. But we try to work with you and make sure that we can collaborate and help provide you the care that you need in a timely fashion. So our team members, I think we're pretty close-knit. We have a really good team. I will say I previously worked in Pittsburgh as a fellow, and I think this team is it's just stellar. I can't say enough good things about all of them. So we're going to go through, and I know none of you really have met many of us, and we're going to go through it, and just from top left to right and then top to bottom, we're going to go through and just introduce our providers that you might see. Just know that just because you see one provider, that person may stay your provider for the entire time if you guys click and it works out well. Other times it's going to be all of us rotate through the inpatient service, except for Dr. Kempinen, who doesn't rotate through the East Bank in the hospital. But you'll probably meet all of us at some point or another if you get hospitalized, or if you have a need for an urgent visit and your normal provider isn't in clinic. And if there's for any reason why you think you don't drive well, or maybe you would like to try out a different provider, that's fine too. We're okay with that. That's not insulting. So just let us know if that's something that you'd like to do. All right, let's start with Dr. Dunitz.
Hi, I'm Jordan Dunitz, one of the adult CF providers. I've been at the university since my residency in 1988. I've been involved in CF care since we started the adult program in 1999. I'm originally from New York. When I came here for residency, I thought I'd be here for 3 years and head back to the coast. And here I am 34 years later, something like that. So it seems like I found a home. So looking forward to meeting you.
Dr. Billings.
I take it I'm next. Yeah, thank you. Hi, I'm Joanne Billings. I've also been here a very long time, since the start of my residency in 1992, and then along with Dr. Dunitz, started the adult cystic fibrosis program. I was in my last year of fellowship when he started it, so it was great to be a part of it from the onset. I'm originally from Chicago, and similar to Jordan, I came here not knowing that I'd be in Minnesota essentially for the rest of my life after coming here for my residency. I'm also the lead investigator for our clinical trials work. I know that certainly with Children's and other of the centers around Minnesota, they've also have been involved in clinical research programs and the therapeutics development network, which is funded by the CF Foundation. And so we have, a very active program in clinical research, and have actually worked hand in hand with the Children's Group for many, many years with referrals, and have a good working relationship with many of the centers around Minnesota, Iowa, and the Dakotas.
And Dr. Kempinen was unable to join us tonight, but Dr. Patil is here.
Hi all, my name is Jagdish Patil, and I also have been here for quite some time. I did my fellowship and training here at the U. This is probably the first time I started taking care of CF patients, just like Joanne and Jordan, but just a few continents away. I moved from India to here, just decided that I wanted to move to the coldest part of Minnesota, coldest part of US, I should say. And so I've been here for 15 years, and well, hope to meet you all in the clinic sometime.
And Dr. Mahan.
Hello, welcome everybody. I'm Kathy Mahan. I'm along with Sarah Keel. I am the co-associate director of the center. Similar to the other docs you've met so far, I am also a transplant and moved here back in 2006, but I am the only one from the South, believe it or not. Quickly lost my Southern accent with no regrets. But I've been at the university since 2009. I did medical school here, went away for residency, but came back for fellowship. So I've been doing CF care since 2016. And I am also very excited to meet all of you.
Perfect. And I'm Sarah Keel. I've kind of already done my introduction, but I'm basically trained in West Michigan for like medical school, came here for residency, and then ended up leaving to go to Pittsburgh to train for cystic fibrosis and pulmonary transplant, and then came back here, and I've been here since 2000. I've been with the center since 2020, but working in CF since 2016. And then Cindy.
Hi, I'm Cindy. Oh, my video is not popping up.
Nope, it's up. You're good.
Oh, it's up. Okay. I'm Cindy. I'm actually the only PA that works in the outpatient part of the CF clinic. I've been here for almost 6.5 years. I am a native Minnesotan, have been with the university in some different roles in the hospital for almost 12 years, kind of total. Let's see, I work probably the most in clinic, or I'm at least there 4 days a week. So if something comes up that's more urgent, or you need to be seen same day or next day, it's very possible you'll be scheduled with me, and I'm looking forward to meeting everyone.
Thanks, Cindy. All right. We have a fantastic team, and so I'm just going to go ahead and start. So some of our everybody is actually here, I think, on the screen for the most part. We're going to try and move this along a little bit, and so I'm going to have everyone sort of introduce themselves when we get to their slides talking about their roles. But our primary social worker right now is Jana Gorman. And we have two PharmD, Sarah Shockley, Angelin Leopold. They're phenomenal. Everyone, I can't say enough about good things about these people. Respiratory therapist, we have Amy Nelson, who you might have already met on the ped side, and then Jen Sherwood as well. Okay. And then for our nurse coordinators, we have KJ. Really nobody calls her Kristen. KJ and Kayla. And then we actually have a third coordinator who will be joining us later in the coming months. For our dietitians, we have Nicole and Tara, who you guys may have already met too, and then Tracy Kaloran, who is our scheduler. All right, KJ.
All right. Like Dr. Keel said, my name is Kristen Jesse, but really no one calls me that. I go by KJ. I've been working at Fairview for the last 10 years, but the last 8 years I've been working specifically with the CF team. My roles and duties have changed and evolved over the last years, but currently I manage all CF patients who are admitted to the hospital. I follow them from point of admission to discharge and help set up any discharge needs, help facilitate follow-up appointments, you name it, just help coordinate care on the inpatient side. And then I also am the triage nurse. So if you call the triage line, you will likely talk to me. So I answer calls from Monday through Friday, 8 a.m. to 4 p.m. The number is here. It'll also be later on in the slideshow as well. save that number. That is my number. Don't be alarmed if it goes to voicemail. That just means I'm on the other line or talking to a provider. So just leave a message with your name, date of birth, phone number, and whatever you need. So some ways or some reasons to call the triage line is if you're sick or if you're having symptoms, if you have questions about your care, if you need to get connected with someone else, call me. So my counterpart, Kayla, like Dr. Keel said, she is on maternity leave. She should be back next month. And she will be splitting up the other duties with the other nurse that is hired on at the end of this month. And so they will be going between clinic as well as office work. So in the clinic, they assist with clinic flow. They follow up on any labs or cultures that are done, and then help coordinate things that are needed in clinic as far as like hospital admission or home IVs or follow-up care. And then they're also the ones that are fielding my chart. So my charting is a great way to communicate with us as well. If it's a more urgent need, I encourage you to call the triage line, because we do technically have 3 days to respond to my chart. I will say we are very rapid and very prompt with our responses, but just know if there is an influx of them, it may take a little bit more time. Any my charts that are sent to a provider will be first fielded by the nurses, and then we will discuss with the providers if needed. Yeah. So I'm happy to meet all you and happy to talk to you on the phone.
Thanks, KJ. All right, RTs. And so I think Amy's presenting.
Hi, like Dr. Keel said, I'm Amy Nelson, and Jen Sherwood is my counterpart. I have been working at the university for about 15 years. Previously on the pediatric side of things. So if you're coming to us from the pediatric clinic at the University of Minnesota, we may have met in the past. And Jen and I support the adult side of clinic for the most part. One of us will always be in clinic, and we alternate days in clinic. So you might see one of us one time in clinic, and then the next time might see the other one, but we work very closely together following the same standards of care. So unlike some of the other centers, we are part of that kind of routine visit. We also do yearly visits though, which include, the full review of your airway clearance and inhaled medications and so on. But we are available to see you in clinic at any clinic visit. So if there's issues with vest fittings, or if there's questions about inhaled medications or things like that, we're happy to stop in and visit whenever. Jen also does some exercise review and prescription. So if you're looking to increase your exercise activity, you'll see Jen in a little bit of a different context as a typical respiratory therapist. We are also available outside of clinic via MyChart and by phone if needed. So if you have a question for one of us, you can just send a message to your provider, and those RT specific questions get routed right to us, and we can communicate that way. In addition, we also consult on anybody who's inpatient with cystic fibrosis and make sure that their care is optimized and that we are coordinating home to hospital and then hospital to home. So it's very consistent and fluid throughout your hospitalization.
All right, thank you guys. All right, dietitians, we have Nicole and Tara, and I believe Tara is presenting tonight.
Hi, everyone. My name is Tara Griffin. I am one of our adult dietitians at the university. Also on the call is Nicole. You want to say hi, Nicole?
Hi, everybody.
Don't feel bad if you think we are the same person or call us by the wrong name. Even Dr. Dunitz does that sometimes. So we get that a lot. Just like the other team members, and this is something that you're used to, you definitely see your dietitian every year. Still see us once a year in clinic. We do follow you if you come into the hospital as well, routinely. It will always be us who sees you. And during your clinic visit that we do see you with every year, your annual assessment, we'll go over a lot of the topics that you see on the slide there. Of course, we are talking about food, your diet, questions you have, GI symptoms, your enzymes, vitamin, mineral supplements. We go over a lot of the labs and tests that you have with your annual studies, your bone scan, your glucose test, all of those things that are so fun to do. We will go over with you. We do a lot of communication with you, sometimes depending on your goals between visits as well. over the phone, through my chart. Sometimes we'll even do a video visit if that would work well for you. And we also work with other members of our team, like the gastroenterologist and the diabetes team as well, if that's something that is pertinent to your care. Anything I missed, Nicole?
All right, thanks, guys. All right, Sarah and Angeline.
Hello, I'm Sarah. I'm one of the pharmacists, and Angeline couldn't be with us tonight, but together we make up the adult pharmacy team. I am a bit unique in that I also work over at the pediatric side, so I get to do a little bit of both. We're here for all things medication. So if you're another provider starting a new medication for you and you're worried it's going to interact, you can always send me a message. Also, if you get a weird letter from your insurance saying something isn't covered, if your pharmacy isn't able to get you what you need, you can always reach out to me and I'm happy to cover those things. So a little bit about my background. So I'm originally from Maryland. I did my Doctor of Pharmacy down in North Carolina at UNC. And then I came up here for my residency, which I did in primary care at the University of Minnesota. So I'm going on my 4th year at Fairview, which is kind of crazy. But 2 years with the CF team. And Angeline is a Minnesota native, studied at the University of Minnesota up in Duluth for her PharmD, and she did the same residency that I did, and just joined our team last June. So yep, can't wait to meet everybody.
Perfect. All right, and Tracy.
Hi, my name is Tracy Clarn, and I do all the scheduling here at the CF department. I do try to answer my phone live, so feel free to save my number. I'm a good contact just in general for any general questions besides scheduling your appointment, but I can also help you schedule any CF diabetes appointments or CF GI appointments. And I will help you coordinate all your annual studies on one day or 2 days or whatever you prefer. And then I will also send you, when you call me to make your initial appointment, I will send you an email with a map and an itinerary of exactly where you need to go at what time for your appointments, and a little bit about the clinic itself and a map. And then we will also set up your MyChart account if you don't have one already. And it's really easy. I can send it either via text message or an email. And we will get that set up. If you have problems in the future, I will help you troubleshoot the MyChart. We can reset your password. We can, whatever you need. If you want to try to combine multiple MyChart accounts, we can do that as well. And the MyChart is what you will send. If you prefer not to call, you can send a message to your provider, to any of our staff via MyChart. So that's it.
Perfect. Thank you. And then Jana. And Jana, I am not sure. She was going to try to be on tonight. I'm going to go ahead and present for her because I know that she is wrangling a small child right now. So Jana is one of our social workers. We're actually just, I believe, might be very close to hiring another social worker, but Jana is wonderful. So she basically participates in yearly visits, which include discussion of your living situation, support, physical health, mental and chemical health, insurance, and finances. So I can't tell you how many times in clinic when a patient comes in or when you guys have questions about finances or insurance or billing, definitely the person that we send in afterward to help you. And also very good for any like mental support or emotional support if there's something else you're going through that you really feel like you need more just in general like support for your mental and health, because we want to treat the whole person. So completes anxiety and depression screens yearly and available for resources, grants, assistance with disabilities, scholarships, mental health, and finances. She's also available for the supportive visits via clinic and via phone. So even if she's not in clinic, she can always follow up with you via phone, which we know is sometimes more convenient for everyone else's schedule. And she'll also follow if you're admitted to the hospital, because again, we know that that can be a really stressful time as well. All right, we have a whole host of other providers as well. So Tracy mentioned like scheduling with CF, GI, or ENT, and we actually have a whole host of providers that we like to refer to if we have specific issues or relating to your CF diagnosis. So we have endocrinology for like diabetes and bone density, gastroenterology, which again, the GI tract, so stomach, any issues we're having there with stools, etc. And then ear, nose, and throat for the sinuses, dermatology, and then urology as well, especially if looking into reproductive health later on. And then we have a whole host of subspecialty providers that are available, even if they're not very specific to CF, we know how to get a hold of them, we know how to refer. So we have health psychology, infectious disease, reproductive health, maternal fetal medicine, and our maternal fetal medicine group is very knowledgeable and well-versed in helping people with CF who are working on getting pregnant or having children in the future. We do have a comprehensive gender care clinic as well, and pain management often. So among others, if you have questions or concerns, we have a list. We can help. These are some important phone numbers, so you can go ahead and write these down now, or you can just access the website later, and I promise all of this will still be there. And we'll also send out some PDFs too, and that your pediatrics team will also have some of these as well. So since we're here, we are going to go ahead and we're coming up on the survey itself. So I believe the survey, did it pop up for everyone?
So the survey has just been launched. You can either
Okay.
answer it now during the chat, and then it will also be available at the end of the webinar and also emailed to you. So there's a lot of options to take the survey.
Yeah. So again, we kind of did this in case people had to leave early, and we'd love to hear some feedback from you about how the first half of this went, understanding that we probably didn't answer all of your questions, and we're just trying to introduce you to our group and our team. So go ahead and fill out the survey if you want to save it for later because you'd like to hear more about what we have to say and want to collect your thoughts to the end, that's fine too. Let's see. I was going to pause for just a few minutes and let you guys fill out the survey for a few minutes, but I think if we wanted to too, while you guys are filling out the survey, there's also a Q&A box. And so I'm going to keep moving forward while you guys fill out the survey. But for the next portion, it's really just a question and answer session with the rest of our panelists, and we're going to give everyone a chance to answer and address any concerns that you might have or any thoughts you might have about transitions. And so if you guys want to go ahead, there's a chat box in here too, and it's a Q&A session chat box that you'll be completely anonymous, but if you want to ask some questions or go ahead and throw some in there, we can go ahead and start answering them. If it stays a little bit blank for a little bit while people formulate their thoughts and questions, we also have a list of questions that we can go through. Sorry, I'm going to give everyone just a couple minutes because I think it's mean to make everyone take a survey while also trying to type out a question.
Yeah, and I'm getting the poll for the survey. They're coming in, so thank you everyone for doing that.
Yeah, appreciated.
There's a question from Jody Determan on the
Yeah, there's a
chat.
question in the chat.
Oh,
Yeah.
perfect. Yes, here's a good one. Do you do virtual visits for people away at college? So great question. We have been known, most of our providers will do will generally make exceptions for virtual visits. However, technically by law, we have to be able to say that you are in the state of Minnesota when we do the virtual visit, or you have to say that you are at least over the border in Minnesota when we do the visit. So we do try to work with you from a scheduling standpoint. So usually there's breaks around the holidays and Thanksgiving and the summer. So we do try and schedule your visits closer to those times if you're aware, like if you know your schedule. And now there's a question in the Q&A. Do you have time to give a patient a tour if they would like to see the center before coming? That is a great question. I don't know. Does anyone else want to take that one?
Yes, definitely. Just let us know. It might be a social worker, coordinator, anyone on the team might do it. But yeah, we can certainly figure that out. Probably best thing to do is let Tracy know, and then we'll sort it out from there.
If anybody else sees a question in the chat or in the Q&A, just let me know, because I'm going to start running through some of the other questions I think that we had gotten previously.
And Sarah, those questions are from the PFAC, right? The Patient Family Advisory
Yep.
Committee?
Yep.
Okay.
Okay, sorry, I'm trying to get these up. So one of the questions that came up is, are team visits scheduled team visits, or do we request as needed? And I was hoping that one of our ancillary staff would like to talk or take that point. Maybe Tara, I'm gonna pick on you.
I didn't hear the whole question, but I'll
Yep.
answer it anyway. You guys know I never have trouble talking. So we do see you sometimes when you might not know about that ahead of time. We're trying to figure out a better way to communicate that to you. We have for many years. But we are always there to staff clinics. So myself, the dietitian, or Nicole, our RT, our social worker, our pharmacy staff, we are all there in clinic when you come to see the provider. And the provider, depending on what you guys talk about first, might ask us to come in afterward and talk about whatever is pertinent to the day, or might ask us to call you afterwards, something like that. But there is also another way that you can request to see us. Before you come to clinic, you get questionnaires. And one of your questionnaires is one that we worked really hard on in our quality improvement team, and it's called pre-visit planning. It's just a few questions that basically asks what your priority is for the visit, but then it also asks you if there's anything that you would like to talk about with each of the team members. You can free text it. There's like some buttons that you can press to, like for dietitian meal planning or something like that. And that signals to us to also come see you that day or follow up with you. I hope that answers the question. Anyone else, feel free to jump in.
I think so. I think the other thing too is, Sarah, I don't know if you want to talk about, so sometimes when we've started new medications, very specifically, I'm thinking of Trikafta in some patients, is like the follow-ups for labs and discussing like elevated lab values. Do you want to talk a little bit about the follow-up for that and how it doesn't necessarily have to be a full appointment?
Yeah, so of course, what we've noticed with, especially with the modulators and such, like, of course, starting a new one, we're required to do those quarterly labs every 3 months. We look at that, but we may have some changes in those values just, throughout life, and we can check those during the visit, but we can also, make plans to check those at your local facility, or you can do a lab visit closer to home if that's convenient for you. So we can kind of and we can do those by phone call, and those are things that you wouldn't always have to see the provider at the same time, but we can kind of coordinate behind the scenes to kind of meet you where you guys are.
Perfect. Let's see. And then one of the questions that came up is, what are the recommendations for specialty care transitions? So for patients who are already seeing somebody in GI or diabetes or mental health from the pediatric side.
Typically, we have you see one of the CF providers first. So one of the folks on this call, and then pretty shortly after, then go see specialty, the endocrinologist, the gastroenterologist, mental health folks. So typically you'll sort of get introduced to the center and then move on to subspecialists. Occasionally, the subspecialties are sort of more burning need, in which case you could see our endocrinologist before you see one of the general CF providers.
And I think one of the other things we wanted to talk about a little bit was some of the expectations. And I think this actually came from the PED side. And some of the expectations is that as you are transitioning to adulthood, and we know that this is a big time and a big change for everyone, is that if your parents have been really involved in your care or your caregivers are always there, that's wonderful. We're very happy that you have such a supportive environment. And we definitely welcome the whole family to come, or all of your support group to come to that first visit. As time progresses, though, we are hoping that as you grow up, basically, and you enter adulthood, that you are starting to take care of yourself and take responsibility for your health care. And we're happy to help you along the way, but we may begin to ask you to come alone to your appointments or to have your caregiver step out for a portion of the appointment so that we can help foster some of that independence. Let's see. Do you have a psychiatrist or psychologist on your team or within your system, or do you refer to outpatient clinics for these supports? Now, that is an excellent question.
Hey, it's Jana. I'm back on. I'm the social worker. I can answer this. We don't currently have a psychiatrist specifically for our CF patients, but we do have psychiatrists that we can refer to on the West Bank, and also just outside clinics like bigger mental health clinics like Nystrom and Associates. And we do have health psychologists that a lot of our patients see. And then we can also refer people out to the other bigger mental health clinics as well.
Thanks, Jana. Okay. Let's see. There's a question about, do we offer online care? And I'm not sure if online care just refers to the virtual appointments or if it refers to like, I'm not quite sure what that one means. I guess I don't know, Kathy, do you want to try to address that one at all?
Yeah, I guess I'm not quite sure either. Certainly some things can be done in between visits. For example, you met KJ today, and if you call in with certain symptoms, we may trial some treatments, in the outpatient setting, and just, request to get feedback from you on how you're doing. And certainly if you're not able to make it in, then we might try to do a virtual visit. But if you're sick, we tend to like to see you in clinic.
Perfect. And then a follow-up question from earlier, and Jana, I don't know if you want to take this one again, otherwise I think somebody else could as well, but what is the difference between a psychologist and a health psychologist?
Well, health psychologists mainly work with you on, so some examples that they've worked with our patients on in the past is like if you have some trauma related to lab draws or just trauma related to your health in general, or if you feel like most of your anxiety and depression or other mental health concerns are because of your CF or other health concerns. That's kind of their main realm that they cover. Not that they can't talk to you about other things as well, but that's kind of the main difference there.
Just a quick expansion on the question about online care. If you were talking about virtual visits, we do virtual visits. We do like to see you in person periodically, but depending on the circumstances, if you live far, way up north or something in the middle of the winter, and you are generally well, we do virtual visits. You do, as I think Kathy said before. Law requires that we are only licensed in Minnesota, so you have to have at least 1 foot in Minnesota while we're doing your virtual visit. But we will do virtual visits, but we do like to see you periodically. We would not be enthusiastic about only doing virtual visits. A lot of our patients have the home spirometers that the CF Foundation provided. If we do a virtual visit, we do like if you send us results from a home spirometer, just so we have some objective data along with the interaction.
Yeah, and along those lines, we've had patients drive into the border of Minnesota and park at a Starbucks and, do their visit in a parking lot in a car. So physically located in Minnesota.
Yes. Tammy asked the question, do you individualize care with the improvements many patients are seeing with Trikafta/modulators? Dr. Billings, would you like to take this one?
So I'm not certain, I'm wondering if this is, do we kind of change our pattern of practice as number of visits and ancillary, support like other team members? So we, even with modulators, we stick with the CF Foundation guidelines, which have not changed. Seeing our patients, trying to recommend that they see us every 3 months. And doing the yearly visits from the team members and the has needed visits depending upon needs. So we do really try and make sure that that's something that we're consistent with. We do appreciate that people are feeling better on Trikafta. Many of you know that the general practice for bronchial drainage has been vest therapy, and we have responded to people's wellness and their, for example, doing more, consistent exercise and allowing that to be a form of bronchial drainage therapy. So in that sense, we have individualized care for people who are feeling, well and, are able to do these things in order to care for themselves. But it's a person-to-person thing. It has to do with your stability, what your pulmonary function is like, what your nutrition is like, and how your overall health is. So we do that. My understanding is that the CF Foundation is getting together, and I think they actually call for patients and family members to be part of a group to reevaluate the frequency of visits. I think that that's an initiative that is just getting started, or at least, kind of forming the committee to kind of think about, is that something that's going to need to continue in the future, this every 3 months? But I think we're at best a year plus away from having, any guideline change. So we have tried to remain consistent with clinic visits, but I do think as a practice as a whole, we have responded to people feeling well and, allowing people to do things like do less vest, maybe less nebs, pulling away some medications that they don't feel are necessary and they're carrying longer. But it's definitely a person-to-person thing.
And I think another plug for the program too is that we are a very large center. I think either the largest or the second largest in the nation as far as adults and the CF population that we care for. Correct me if I'm wrong. And so I think one thing is that we have, because of Dr. Billings and Dr. Dunitz and the path that they set up, is that we are very heavily involved in the therapeutics development work as part of the CF Foundation. And so even if you were not a candidate for some of the newer modulators, we have other therapies and other trials coming down the line that we're often a very big part of. And so if that's something that you're interested in, we do have a very highly qualified research team as well.
And I guess one more thing to expand on the care. I mean, the question was, do we individualize for modulators? Frankly, we really individualize for everyone. We're very strong proponents of co-production of care. We work together with you to figure out what's working, what you're able to do, what you have time to do now, what you have time to do later. So really, I think, we want you to be as well as you can for as long as you can. But we, each patient we view as an individual, and, their response to all of the various interventions varies. And so we do try to work together with you and learn from you to what works best for you. So modulator or not, we try to individualize really for everyone.
And I'll just add, kind of similar to what Jordan sort of was saying, there has been work from the CF Therapeutics Development Network about people on modulators and how can we lessen the burden of care. And, there was a study that came out at the end of last year that was done by many of the centers around the country, looking at patients with a certain level of pulmonary function and the use of hypertonic saline and pulmozyme, and the results appeared that in some individuals that we can stop doing, these nebs potentially. And again, this has to do with, are we saying everybody as a whole, go ahead and stop these things? And it really is something, that is part of, our kind of one-on-one with our patients about, kind of what's best for them. As we get the data back from this, so these things that are being, kind of thought about and studied, so that we can hopefully kind of lessen the burden of care for our patients if they're feeling well. So there's also research work in this field as well, which is really exciting. But again, you know, this is something that we're not universally saying, no, everybody go ahead and stop this stuff. It's really, you know, our one-on-one conversations with our patients and kind of deciding what's best for them and their health.
All right. Right now, it looks like we don't have any more open questions that I can see. Correct me if I'm wrong. And so, you know, I think it's actually okay. It's 6:52. Can probably end with 8 minutes left to go. We want to thank everyone for coming tonight. And between the panelists and all of the attendees, we're really appreciative and we hope to hear back from you. We hope to meet you soon. I will go ahead and flip this slide back to the numbers for scheduling and the nurse line for triage, and look forward to all of this being uploaded to the website along with a few PDFs in case you lose the ones that were sent out in your folder before you transition from PEDS. And let us know if there's any other questions or anything, other thoughts that you guys have about the session or about your upcoming visits. We're really glad that you guys could come out tonight, and we're glad that this was the first event we could kick off. Thanks, everyone.